Good afternoon everyone. I'll be presenting on Brolucizumab in pachychoroid disease. Sorry, my slides are not moving forward.
Slide देखो.
Okay. So what is pachychoroid? It is a disorder of choroidal vasculature. The key defining features include choroidal hyperpermeability, which is detected on ICGA, with inner choroidal attenuation. It is the presence of dilated halo vessels, which are the pachy vessels, which make this disorder characteristic. There is focal increase in choroidal thickness. So it is not just one disease, but rather a spectrum. With improved retinochoroidal imaging, this has led to better understanding of this disease and help them differentiate them with other retinochoroidal diseases also. So progression from one disorder to another is frequently observed. So the spectrum includes central serous chorioretinopathy, pachychoroid pigment epithelopathy, polypoidal choroidal vasculopathy, peripapillary pachychoroid syndrome, and focal choroidal excavation. So about Brolucizumab, it is the anti-VEGF with the lowest molecular weight with higher molar concentration. It has the potential to effectively penetrate the choroidal and retinal vasculature, which positively impacts its durability. Now with the non-availability of verteporfin dye and decreasing PDT, there is a need for some therapeutic measure to target the choroid. And here comes the rationale of using Brolucizumab in pachychoroid disorder. So we did a study to evaluate the efficacy and safety of intravitreal injection of Brolucizumab used as PACHYCHOROID in India in previously treated patients of pachychoroid syndrome with PRN regimen. Primary objective was to assess the functional improvement, and secondary was to assess the anatomical improvement in terms of central subfield thickness. We also measured the changes in PED height or resolution of sub or intraretinal fluid, and occurrence of any ocular or systemic events were also noted. So this was a single center retrospective analysis. We took the records from Jan 2021 to July 2024, and we included the patients who were given PRN regimen of Pergenex for CSCR, PNV and PCV. We excluded those who had received anti-VEGF agents within 2 months, any intraocular surgery within 3 months, and the patients with hazy media which obscured imaging. So out of 161 eyes of 141 patients who received Pergenex on PRN regimen, 23 eyes of 19 patients who had received 66 injections met the criteria. And we recorded best corrected visual acuity, central subfield thickness, and changes in PED height. The patients were categorized based on the follow-up of 3 months, 6 months, 12 months, and 24 months. Now, 11 patients with the follow-up of 3 months, mean injection ranging 1 to 2, showed significant improvement in best corrected visual acuity, along with improvement in central subfield thickness. 5 patients with follow-up of 6 months, they showed improvement in best corrected visual acuity and CST, but it was not significant, probably owing to the smaller sample size. The 4 patients with 12 months of follow-up, they showed bit increase in logMAR BCVA, that is bit falling BCVA, but this was insignificant, but they showed significant improvement in the central subfield thickness. And 3 patients with 24 months of follow-up, mean injections ranging between 6 to 8, they showed unchanged BCVA with improvement in CST. So cumulative data of all the patients showed that they have shown stable BCVA, decrease in central subfield thickness, and decreasing PED height from baseline to final follow-up. So 9 out of 23 eyes, they showed improvement in BCVA, that is 39%. Stable BCVA was shown in 12 out of 23 eyes, that is 52%. 2 eyes demonstrated loss of 1 Snellen's line, that is 8.7%, probably owing to the natural course of the degenerative disease. 20 out of 23 eyes showed a reduction of CST, that is remarkable, 87%, and 14 out of 15 eyes showed a reduction in PED height, that is 93%. Also, no adverse events, specifically any incidents of IOI were recorded. So to conclude, PRN regimen of Brolucizumab was effective in improving and maintaining visual acuity. It showed marked drying effect. Although Hawk and Harrier studies have showed reported IOI incidences of 4.6%, and VRSI study group has showed 0.79%, no patient developed IOI in this analysis, maybe due to smaller sample size, and that Brolucizumab is effective in managing recalcitrant cases of pachychoroid disease spectrum. Limitations of the study is smaller sample size. It is a retrospective analysis. We haven't got any comparison group, so this limits the power of study. And larger studies are needed to validate these results. Thank you.
Any questions?
What particularly, when do we say that, is there a particular measurement for specifically telling that this patient is having a pachychoroid?
Pachychoroid disorder. So, based on enhanced depth OCT, if it's 129, 290 microns.
Is
It
it 290
is.
or 390?
Sorry, sir. So basically, it is a range, and it is not just choroidal thickness. We have to look at the focal dilatation of Heller vessels, which appear as large hyporeflective lesions beneath the RP. So even if its focal increase in choroidal thickness can be considered as a pachychoroid disease, along with the other more characteristic features which include hyperpermeability on ICGA. So choroidal thickness, yes, so I must have forgotten the exact number, but it's more basically focal.
So I think that you could have tightened up your exclusion criteria by excluding cases with history of uveitis, or because as such brolucizumab is associated with IOI.
With IOI.
What do you think about that?
So basically when we were taking out the records, we
This
there
is
was
retrospective
this is a
study.
retrospective analysis. We took out the records. None of the patient had any history of uveitis. Also, if it's a patient of uveitis, we avoid brolucizumab at all cost. We don't give.